Okay, so I'm sitting here with Sara. Hey, will you tell me first who you are and your specialty, your education behind the subject that we're talking about?
Of course. So my name is Sara Nudd, and my background, so for the last 20 years plus, right, I've been a pediatric nurse. And then within that role, a lot of, coaching and facilitating new parents as they are now navigating this parenting journey.
Yeah.
So then over the last 4 years, I've really become to know and understand and actually realize that a lot of families are experiencing postpartum mental health issues. I think it's becoming more, I don't want to say accepted, right? But we are doing a lot of work to decrease the negative stigma upon perinatal. So, and then perinatal, right, means the period of pregnancy and that first year postpartum.
Okay.
And so perinatal mental health issues are, I think we're doing a lot of work to really increase awareness and increase awareness around resources and support. So over the last 4 years, I've really kind of started to take note about all these families that we've been working with, whether it's in my pediatric nursing role or a role as a sleep consultant, that a lot of families need support. A lot of families are either, I think, kind of navigating the parenting journey without support, and they are feeling really lost and stuck.
Absolutely.
And so a few years ago, I went back to school to get my nurse practitionership, I suppose, if you will, focusing on psychiatry and mental health. I recently completed a perinatal mental health certificate. And then, so that actually kind of gives a increased foundation, right, as far as the mental health issues that are out there, the kind of modalities as far as treatment and psychotherapeutics and just interventions that could help parents, right?
Absolutely.
Whether that's moms, dads, caregivers. Fill in the blank right there. So
yes, I think that's big, right? That yes, it's very much a focus on moms, but there's layers to that onion, right? There's more involved. Now, are you a mom yourself?
Yes. So we have 4 kids. So we are a blended family. Kind of long story short, I am married to my summer camp sweetheart. So we met when we were 12, right? And so every year we would meet at summer camp for a few weeks. And then when we were 16, then we became a thing, right? So we were in high school. And so our summer romance, our summer love kind of continued into the school year. And as high schoolers do, of course, we broke up and went our separate ways.
Right.
So then in college, I met my first husband. And then when we got married, my now husband, my summer camp sweetheart, came to our wedding. Aww. And so there's pictures of all of us, right, back in the 90s. And then I got pregnant. I was 21 when I got pregnant with my first. We were in college, and it was a surprise.
Sure.
And so then when Zach was born, he was born with a congenital heart defect. So again, we're 21. We both stopped, or I stopped school to work, and then my now ex-husband, kind of continued on with school. But anyway, so my oldest, he was born with a congenital heart defect. We were in the NICU for a week. We were sent home on oxygen. Again, this was back in the 90s. There was nothing. There was no screening. I don't remember anyone
checking in
to be hey, this gal's 21. She's now stopped going to college.
Yeah.
She's transformed her entire
Your whole life has shifted, right?
Financial stresses of 21-year-old family now with a kiddo, a baby, right, who's home on oxygen, all the things.
Wow, I did not know that.
Yeah.
That is a lot at that age, of course, but just in general.
Right.
New mom.
Right.
New life, new chapter.
Right. Family history of depression. Looking back, I'm pretty sure that I was also, should have been diagnosed with depression, even pre-pregnancy. But, again, hindsight.
Yeah.
So then we, kind of went through life. My ex-husband graduated school. We moved to Denver, and then my next kiddo was born again. Postpartum. I truly believe I had postpartum depression. I also, looking back, think that my ex-husband also probably had some postpartum depression as well.
Yes.
And we're just now finding out that dads also
that was not
experienced that.
Even now, for as far as we've come, that's not typically understood.
No.
That partners can take just as much of that weight
Right.
as moms do.
Right.
So I agree, but also in the time that you were having your children, do you feel like you saw signs on the wall, any kind of visual element of warning that could be a potential risk to you?
I don't think that the awareness was there. I remember with my oldest, I remember like having this mentality, like this visual in my head that I was like stuck in this just gray fog and climbing on this ladder, trying to get myself out because I knew I just felt so heavy and dark. But then it was like one of those ladders where the rungs just like
keep going down.
Keep going. And I remember just working so hard to kind of like visually climb out, but I could never climb out.
That's a very good visual metaphor for that.
And feeling just so frustrated at myself, so full of like shame and guilt, not knowing the words that I needed to like ask for help, knowing that like, I do feel like I knew that I needed help, but I didn't know where to turn, how to ask for it, even like what words to say. And, you know, back then in the 90s, I don't even know if like I would have said, you know, I'm feeling these feelings, if that would have even like
registered for anyone.
Been a thing, right? I think baby blues, sure, they could have said, you know, it's just baby blues.
Right.
Like put your big girl panties on.
Totally.
And like move on with life.
I think that has maintained.
Right.
That has maintained, whether it's other people or us saying that to ourselves, which is a big
like,
issue.
Suck it up, sister.
Right?
Get over
and
yourself.
You think, you know, I was warned my life's going to change. They told me, you know, my life's going to change.
What were you expecting?
So this is what that looks like.
Yes.
Oh gosh, that's what this looks like. You know, there's these kind of panic moments of, I don't know that I knew what I was signing up for. And that isn't fair necessarily to us, if fair is even the word. So that was something you definitely feel like you experienced. And I hear that a lot from moms of even my closest girlfriend who had a big gap between her kids. She said, I definitely went through some version of that, but while it was going on, I'm not even sure I had enough wherewithal to identify those feelings. So how do you ask for help when you're not even sure what kind of feelings you're having in this big flood of feelings?
Right.
So how do you feel about that term baby blues? Because that's a big one.
So I personally have like a love-hate relationship with the term baby blues. So I think it's a pretty common term, right?
Yeah.
And so I'm a big proponent of let's like increase awareness, right? Let's reduce the stigma. Let's talk about it. So because baby blues is pretty common, I'm a fan of it in that aspect.
And can you define it for people?
So baby blues, right, is typically what moms will experience up to the first 2 weeks following the delivery of their baby. Pretty like mild symptoms of sadness. However, you will still be able to carry out normal daily activities, right?
Okay.
You will, still be able to get out of bed and function, shower, versus, right, you're like postpartum depression or anxiety. These are going to be like more intense, more debilitating symptoms. And so there's definitely like two paradigms, if you will.
Right.
My hate relationship with baby blues is just the fact that when moms are either, kind of assessing themselves as far as like their symptoms that they're having, or even if they go into a well-meaning provider who just may not have either like the education or the background or the training, they may just almost like, discredit mom's symptoms, right? And be like, it's just baby blues.
Right.
Give it time. You'll feel better. Right. And so,
becomes a little too large a blanket
right.
for those symptoms
right.
that go from, like you're saying, mild exhaustion is of course a factor. We're not sleeping very much. But then when does that threshold get crossed from mild symptoms to debilitating, not able to care for yourself? Definitely. I kind of said in a conversation earlier where we're so focused on caring for other people, the children, our relationship, our partners, even the household, that we are the last people that get cared for by ourselves or others, even with the well-meaning friends, family, loved ones. What is that threshold? I think we might need to define that a little more strictly moving forward.
Right.
I'm not sure how to do that.
No. And I think like it's honestly like projects like you're doing, right? Like the increased awareness.
Yeah.
Like let's just continue the conversation. Let's normalize what these women and men really are feeling,
Yes.
right? And then if they are able to articulate, I'm feeling this way, it's impacting my life this way,
Right.
then when they do go to their provider, hopefully, right, as we continue to increase awareness in the conversation, the provider will be able to, offer them more resources.
Sure.
Now, with that being said, I still think that there's limited resources. I think that this work is just beginning.
Yeah.
And so, like, the more awareness of the resources is great, but we have so far to go.
Yeah.
I think right now, for forever, right? You've seen like support groups, right? Like there's like group therapy and peer support,
Which is wonderful.
absolutely. But we just need more, right?
Yeah.
There's tons of research, and if you want, like, I can send you
Yes,
like
please.
all of that,
All the data.
But
all
there's
the time.
tons of research on how impactful peer support groups can be for postpartum depression.
And when you say peer, you mean moms helping other moms.
Moms
in the
helping
same.
other moms, right? You'll have a facilitator who may, have a clinical background, may not, and that's okay. But yes, in a kind of formal set, well, when I say formal, right, it
Right.
could be just like casual conversations like this.
Yeah.
Could be Zoom, but like weekly, if not every 2-week support groups where moms then are able to kind of validate their feelings among each other.
Yes.
They're also able to like share their experiences. That has been proven to be very helpful. However, with that being said, and that's for like postpartum anxiety, depression, very helpful.
Yeah.
If, sometimes moms like they may need more than like their peer support groups, right? And that's when like your one-on-one counseling comes
Yes.
in. There is, kind of we talked about before, right? There's perinatal mental health certifications, right? So like these practitioners go through specific, I think it's like almost like a 2-year long program, right?
Okay.
Where they are specifically trained in the perinatal mental health mood disorders. And so I would also advocate for moms to, if they are, able to really find out that their counselor or their like licensed clinical social worker does have that specific perinatal mental health certification
That's a
background.
specialty, right?
Right.
Like that really digging into this particular aspect of mental health.
Right.
Which is underdeveloped from where I sit. Do you feel like that's true?
I would absolutely say 100%. And I think a part of it too is the screening process.
Okay.
There's, when you are in your last trimester of pregnancy at your OBGYN office, you'll probably fill out a piece of paper and, you may...
Oh, that piece of paper.
Right, that piece of paper. And, you'll score kind of like how you're feeling on certain questions.
Yeah.
And then typically you also will fill out that same piece of paper after your baby's born. Maybe at your 6-week postpartum check, maybe not.
Talk about a love-hate relationship with that piece of paper.
Right, and then that is it. However, okay, so we'll just kind of go on this tangent, right? So postpartum, the postpartum period is defined
This is something I'm really interested in. Yeah,
right,
so...
there's a range of definitions as far as the postpartum period. So some literature says that the postpartum period ends at 2 weeks. 2 weeks following delivery. There's other literature that says postpartum period ends at 6 weeks.
Right.
There's other literature that says the postpartum period ends at 12 months.
Right.
I am 100% on the 12-month, if not even later or greater.
That's what I wondered. Is there any literature about that extending beyond the 12-month?
There at this point, I don't know if there's any literature that will say it can,
Definitively.
right? But I would say among the professionals that deal with this population, absolutely, I would say and support that it goes past the 12-month mark, right? But again, it's all across the board.
And I understand the different schools of thought. In medicine already, we have so many schools of thought depending on the subject matter. So I completely understand that. But you're telling me that inside of your classes, your experience at work, all of that, you feel like your colleagues and yourself, you feel like it extends
absolutely
beyond.
At least 12 months, if not beyond.
I feel like women need to hear that. I needed to hear that.
Yes.
I didn't even recognize my symptoms until my son was 6 months old. And I likely could have if I hadn't had the mindset of, oh, this is normal. I'm supposed to feel completely terrified and debilitated, which obviously is not what we want moms to be feeling or partners to be feeling.
Right.
Do you feel like, and this is a tough question, it's one that I almost hesitate to ask, but I think it's important. Do you feel like postpartum is taken seriously by doctors? And I don't just mean labor and delivery doctors, primary care, labor and delivery, nurses, the whole gambit of postnatal care. Do you feel like it's recognized?
I don't think it's recognized, not to any malicious intent.
Of
right?
course not, no.
In all the work that I've been actually recently been doing as pediatric nurses, providers, at no point do I ever remember going through a training as nurses who are, really partnering with families during that postpartum time to recognize what to look for in caregivers, moms, dads, and then offer resources. At no point. And then looking back, right, in like all of, our newborn families that I've cared for over the years, right? Looking back, I feel like there's so many families that were having a difficult time adjusting, who, I feel like they were able to recognize that they were, I don't want to say suffering, but I'm going to say suffering.
No, I think that's accurate.
Right, but weren't able to articulate, this doesn't feel right. Right, and then if they would have just had someone come to them and say, you know what, I see what you're going through. This is normal. However, you're not alone, and there's resources.
Here's what we can do. Here's steps to take.
Absolutely.
People to talk to. How much comfort do we all get from, whether it's this subject or any subject of difficulty, another person saying, I felt the exact same way. You're not alone, or I went through the same thing. Here's my personal story. I mean, that's why we read books. It's why we consume media of any kind, because we want to feel seen and heard and understood, or maybe we want someone to help us with the language. I don't know how to say how I'm feeling. I bet you have the words for me, particularly when you're in the thick of it. That piece of paper. I was given that piece of paper at, up to that 6-week visit. And I would read the questions and I would think to myself, if I circle my true answer, are they going to take my baby away? Are they going to institutionalize me? Am I going to be put under some kind of microscope that I don't feel strong enough to withstand? So I feel like while that piece of paper is an effort, and I don't overlook that, and I agree nothing is malicious, inside of doctors, nurses, all of you are there because you care and you want to take care of your patients and take care of the people in your community. But I think because it's not talked about as openly and as freely without guilt and shame around, you said a really great thing when we originally spoke on the phone, and it was, when you have strep throat, right? You don't have any shame in going to the doctor and asking for medicine and asking for help and getting tests and figuring out what's wrong so you can fix it.
And even sharing with your friends.
Right.
I had a sore throat. I went to the doctor. Now I'm on an antibiotic.
No one's going to look at you like you decided to get sick.
Right.
And unfortunately, I think with postpartum, that was my experience of fear of people are going to think I'm ungrateful or I'm not a good mom. And that was a really scary, hard thing for me to say out loud for myself. Forget the other people's opinions. For myself to hear that. I really struggled with that. And I think at 21, I was 35 when I had my first son. Do you feel like there's sort of any kind of effect of age, number of children, like having postpartum with one versus the other? What are your thoughts around that?
Yeah, so risk factors, right? So if with one child, you are at a higher risk with your subsequent children of having a postpartum mood disorder, right? Other risk factors, right? Financial stress, of course, life adjustments. Those are certainly risk factors. Family history, if not personal history of any kind of mental health issue. Thyroid, endocrine disorders also put you at a higher risk.
I didn't know that.
Right.
Okay, that's good.
And so, I think that those also should be, I don't want to say publicized, but we
Heads
just
up.
heads
Like,
up.
let's give a heads up.
Right. We also need just to get the word out,
Yeah.
right? I think right now with how our healthcare system is set up, right? The current reimbursement model for providers and physicians, hospitals, right, is the providers may not have the luxury
Sure.
of really digging in to say, you know what, how are you really feeling?
From human to human, right?
Yes,
Yeah.
I see what you scored on this, but
Yeah.
I don't know if I want to dig in a little bit more. Let's take the time to really assess what's going on. I also think, and again, no malicious intent, right? I think they may take that piece of paper, quickly scan, quickly, and maybe, they may not even intentionally do this, right?
No, they're busy. You guys
right?
have, very limited time to
Right.
see each of your patients.
Right? And you've got this long patient load, right?
Right.
Do you have the time and the wherewithal to really sit down with this family and dig into what's going on? And I feel like the answer could be no,
Yeah.
right? And I think a lot of times
Unfortunately.
it is no.
Yeah.
And then these families are going home and feeling just as lost, just as unheard, just as unvalidated as when they went in. And now what, right?
And what's the point now, right?
Right.
I kind of open up with my second. I did circle those, honestly. I did answer those questions honestly. And it was crickets. I heard nothing.
Yes.
So, and that was my second kid. I was aware of what I had experienced, and I had some knowledge behind what helped me move through it with my first. Far too late. It probably could have been taken care of earlier. And so those, that's a tricky thing. And I think that it's a bigger issue, right, than even just postpartum. Examples that doctors and healthcare professionals do have a huge caseload and not enough time to really assess each individual patient. And it's not for lack of care.
Right.
It's not for lack of intention.
Right.
But what do we need to do? What needs to shift to fix that? And this is so far beyond. I certainly don't have the answers, but I'm curious about it. Yeah. Okay, so we talked about kind of the timeline of postpartum and how that maybe the reality of it doesn't match what we're learning is true. And I think that's a whole part of moving forward and making strides to fix it. What is a typical treatment? What does that look like? What resources are in place for people?
Well, of course, it depends on kind of the symptoms, right? Is it more like depression, more anxiety, more OCD? It just really depends.
Okay.
A lot of the times, right? Counseling, psychotherapeutics, mindfulness practices, CBT, like we talked about before, peer-to-peer.
What is CBT? Is that peer-to-peer?
That's
groups?
cognitive behavioral therapy. So a lot of the times, for moms who are having more postpartum OCD, it's about recognizing that we talked a little bit earlier, off camera, about intrusive thoughts, right?
Yes,
So if a mom is having an intrusive thought, CBT is just a modality, right, for her to kind of practice to recognize this thought that I am having. It is not truth. I can see that my baby is fine, and then you replace that thought you redirect that thought, and then you replace it with a positive thought.
Right.
And so it's just more of a mindfulness practice, if you will.
I think mindfulness, and I don't want to interrupt you, but that is a newer kind of. It's not really, but calling it mindfulness.
Yeah.
And I kind of want to touch on what those intrusive thoughts are, what that looks like. Because for people who maybe are new pregnant mothers who have not yet had a child, or for perhaps a woman who didn't experience those kinds of things, that was for me one of my biggest struggles. I'm already kind of an anxious person. I overthink. I tend to overthink. I think certain personalities, right? We want to go through every scenario very quickly in our mind of what is potentially at stake and what's a risk. And I think when I had my first son, especially, the intrusive thoughts of he's going to die in his sleep. He's going to hurt himself, and I'm not going to be able to handle what has happened. Am I really equipped to deal with any kind of an emergency that takes place? we take all these classes right before we have our kids, telling us how to perform CPR, how to Heimlich maneuver. I think I was almost obsessively scared of my kids falling down the stairs, of my kids choking, and me not being able to, in that moment of high intensity, handle what was going on. And those intrusive thoughts, when you're not able to redirect, can go down a very panic attack driven moment of I am not equipped, and how far you allow yourself to fall into that I am not equipped on repeat like a broken record. It can go to some pretty dark places, some pretty scary places.
And then I think that you also begin to like second guess your own judgment.
Yes.
Yeah. So, for example, we were talking earlier, I had a client yesterday who her baby is 4 days postpartum, and the mom has a medical background, and she just was almost perseverating yesterday that like her baby had leukemia. Yeah. Now she knows that her baby does not have leukemia. She can assess, and like her baby is well, and her baby's doing fabulous, right? But just this intrusive thought just kept like returning and cycling, and she recognized that it was not a truth.
Right.
She recognized that it was an intrusive thought, but it still kept occurring. So it's just really a practice, right?
Yeah. I like that, a practice. You have to keep coaching yourself, and hopefully with the resources we're talking about, find someone who can hold your hand, as it were, emotionally through. If you're not feeling strong enough right now, I am a resource. You can call me. You can set up a time to come meet with me. You can have friends on hand that have been through it, that can tell you,
your community,
this is okay. It's okay, and it's not real. This is the funny thing about becoming a parent. Because I'm an artist, and those who know me watching this will giggle, I'm sure, because I am a very imaginative person. It's what makes my art strong. It's what makes it emotional. And perhaps, I hope always, people want to see more and more of that makes them feel big feelings, right? But when you are someone who feels big feelings and those feelings turn negative or dark, it can envelop you.
Yes.
And without learning the proper way to shift into a healthy place, that's the key, right? That's where we have to learn that we are strong enough to go from our reasonable self, our logical, I know my child is safe. I know that I'm capable. I know that I care enough to jump into action if something were to happen, which likely it won't. And that's the thing that your reason and your feeling, there's this big kind of invisible monster sitting between those.
Absolutely. And I think nowadays, right, so we have so much technology when you have a new baby, right? You have like
conveniences,
right? And then there's like the Owlet or the Nana, these monitors that the baby, wears while sleeping, and a little camera that like points down at the baby to then tell the parent's phone, their vitals, right? Like their oxygenation level, the respiratory rate, their temperature, all of these data points, right? And so I think also, I think that some parents also just get fixated on these data points.
That's the word.
Right?
Fixated, yeah.
And versus like what they are seeing with their eyes. And I think that also becomes very anxiety provoking. And so I love some of the technology, I super love, but then also I think it's a double-edged sword for some parents who it's actually causing them more anxiety.
It did for me, for sure. Unintended consequences, right? It's a great idea. It's wonderful. I ended up wanting to get one of those monitors so that I could see what his breathing pattern was, and I could see if he was rolling into a corner of the crib and he got stuck. And even with my husband, who is a paramedic, he's got a background as well in medicine, and I, thank goodness, felt very comforted by his knowledge. But that over fixation of awareness was actually working against me, and I just became obsessive.
And I feel like that's also very common, but I also don't think that people talk about that necessarily as well.
Right.
And so, I think that these technology things, work for some families, but I also want families to recognize if it's not working for you, it's absolutely okay to not use it.
Don't
right?
use it. I had to eventually, and it was actually my husband who had to do it for me, kind of say, look, I have to take some of this away from you.
Yeah.
Because it's not helping you and you're not relaxing. It's meant to be a tool to help you calm down and get your rest and go to sleep at night. And it was doing the opposite for me. Yeah.
Absolutely.
So I want to ask a little bit more, and this is hard because as we've gone from like, the 90s where we started talking about postpartum depression, and that was kind of it, right? The depression. But now we're looking at things like postpartum anxiety and OCD, and even there's another term, and I've lost it, not postpartum psychosis, which was kind of the big, deep, dark, scary
And that
one.
is an emergency, right? So postpartum psychosis will happen with 1 to 2 out of 1,000 deliveries, right? Okay. And that is an emergency. So that would be, like if we were to like equate it to like our physical health, right? That would be for you or I to have a heart attack right now.
Right.
That, like in a physical sense, emergency sense, that is postpartum psychosis. But really, you can have like postpartum depression, anxiety, just like you were saying, OCD.
And OCD, for those people who are not familiar with what those symptoms, what that looks like, and also how common is it that you guys are starting to see that?
Well, great question. As far as statistics on like diagnosed or postpartum OCD, there's not a lot of literature. Most of the literature will tell us about statistics on postpartum depression. They're just now starting again to like screen for anxiety. So OCD, we don't even have like the statistics.
And what is OCD?
Okay, so obsessive compulsive disorder is OCD, right? So your fixation on certain things. A lot of the times, parents who are experiencing those symptoms, they may just have like debilitating fear. They may have like debilitating almost patterns or behaviors that offer them comfort at the time in order for those like symptoms to kind of like subside a little bit.
Go down a little bit. Like checking on the baby while they're sleeping. Right.
Or, perhaps even like, you have to have like the lights turned off or on so many times before doing a certain, household process. So it really will look different to each family. But that's just kind of a newer, kind of term that we're just now realizing can also be included in the perinatal mental health mood disorders.
Absolutely.
So it's, again, just like you've mentioned, we're just I think really beginning to do a lot of eye-opening research and support, but we still have so far to go.
I agree. I think to things like this, where we're just learning together to make people more comfortable to say, actually, I did feel that way, or I did go through some of that obsessive behavior, or too much anxiety to leave the home to take baby out into the world. One of the examples that I have personally that is hard. When I had my second son, my family came into town and they wanted to go to a restaurant for lunch. And I've packed up the baby. I've got my 2-year-old. I've got my 6-month-old. And any parent who's watching this knows, there's quite a bit of rigmarole, right, to get out of the house and to get babies in the car and get them strapped up and have what they need. I get to the restaurant and we walk in and it's packed. I mean, the tables are really close together. It's loud. It's the lunch rush. I've got 6 of my family members with me. My son, my 2-year-old, needs to go to the bathroom. My baby is crying because he's overwhelmed. And in that moment, I grabbed my kids, grabbed the bag, and I had to leave and got them safely in the car before I had a panic attack. I mean, I couldn't handle the sensory overwhelm of it. And I think, getting to a safe place, then there's all that guilt around, I don't want my kids to see me going through this. My 2-year-old may be young, but he's old enough and they feel our energy. And I think a big thing that I was overly aware of was imprinting. Am I imprinting on them? Am I giving them my anxiety? That's still a struggle that I have.
And hearing you tell this story, like, this is what I'm hearing, right? So, my parenting style and just like my style in general, as far as like teaching about your body, parts are parts, right? Mm-hmm. Your elbow is equal to your penis, as far as like we should just be able to say elbow and penis.
It's right.
Same thing with emotions, right?
Right.
Sadness, fear, just another emotion, just like happiness, right? And joy. And so I would love for us to alleviate all of like the weight that we put on ourselves for experiencing fear and panic and tears and crying. Right. It's just another emotion, right?
Right.
And the fact that you were brave enough to like remove yourself from the situation, but also show your children, like show your 2-year-old that I didn't feel comfortable, and I advocated for myself, and I advocated for you too, because like it's my job to protect you, and I got us out of that scary situation. So I hear like just only good things, and like I want to give you props for like recognizing that within yourself. And
thank you.
It's
so hard to think about even now. And I know, again, there's that logic and there's that feeling, right? My logical brain knows that I didn't do anything wrong, and that there was no shame in leaving that situation, which at the time, to be honest, that wasn't necessarily bravery. It was panic. I mean, I had to get out of there, even just to sustain my energy and my ability to function. But I agree that if anyone else were to tell me that story, I would feel the same way. I would want to say to them, like, that, of course you were overwhelmed. That's an overwhelming situation for most people, particularly with a little and a baby.
And another little.
And a little and another little. But I think even just in telling the story, and it's been 4 years since that experience took place, I can go back there in my mind too well and feel those feelings again. And I like hearing you advocate for showing our kids genuine emotion. We are not robots.
Yes.
We are parents. It's our job to show our kids that it's okay, even as far as tantrums are concerned. We need to be able to acknowledge and accept, and then, find the direction for those feelings that make sense and are spoken out loud. Say the damn thing is something I find myself saying a lot, not to my kids necessarily, but to other adults. Say the thing. Let's just start getting comfortable with saying it, whatever it is, even if it's a little uncomfortable. What's more uncomfortable? Saying the thing and acknowledging a reality that we are in. Perhaps there's information we don't have from the other person or from the situation that we could extinguish the fear so much faster if we were talking about it, versus holding it inside and creating, Brene Brown, the story I'm telling myself, right? This is the story I'm telling myself. We are just one facet of a bigger machine. And if we can start getting to the root of where those feelings are coming from, whatever the situation in postpartum, that's what I want to focus on with this. But as adults, I think we've gotten, I don't know, maybe too polite, maybe too afraid, maybe a combination of both of those things. But there's got to be a way for us to work together and carry this thing together. One person carrying it is a lot heavier than all of us coming together.
Absolutely.
So you shared, and I appreciate your own experience. If you could kind of say anything to new moms or moms who are having, more children down the line or are in it right now, what do you want them to know, and what do you want them to do for themselves? Right. What's your advice?
So, first thing, right? Like, you are not alone. There are, I want to say very many. There are so many other women and caregivers who are experiencing this, like, similar symptoms, right? Similar feelings, similar sensations. And so just know that you may feel like, when you go through like a breakup, right? Especially like any breakup, even in high school, college years, 20s, right?
Particularly,
right?
So heightened.
Right? You just feel like it's just heart-wrenching, and you are the only person that has ever felt this, like, soul-crushing loneliness and ache, right?
Right.
Loss, right? And I think like same kind of just isolation feelings happen during like the postpartum time. And I just want to get the word out to all these families that, like, you are not alone. What you are feeling is normal. It will pass.
It will pass.
But it doesn't happen overnight. And to give yourself that that gift of knowing that, you may have like a really bad day today, and that's okay. Tomorrow is a new day.
Yeah.
You may have another bad day tomorrow,
Yeah.
and that's okay. The next day could be better. Just hang in there. Like, you've got resources, you've got community. It's going to get better.
Absolutely.
Yeah.
Yeah.
I want to take just the isolation factor off of these women, right?
Those words,
and the judgment.
those are the main word of isolation and hyperfixation and just feeling, I mean, whether you have a healthy postpartum experience or not so much, isolating is what that first year particularly feels like.
Right.
You're in it,
And I think, goodness, right, the families and the women who had babies during COVID, like lockdown times, who had to deliver all by themselves, right, who were then, quarantine isolated during, again, like the lockdown, then kind of coming out of COVID, I think that we're still just learning about all the repercussions that has caused, for all of us.
For all of us, but I agree for these parents who, we're all sitting there saying it takes a village, and unfortunately with what we've all just been through, there is not so much of a village available to you.
And social media. Right?
Oh, social media. Let's talk about that for a second.
Right. I think that's a big thing that I really want to advocate to parents. And it's hard, right? I think that we find connection on social media.
Yeah, of course.
I think that we find diversion,
inspiration.
You
can kind of disassociate a little bit.
Absolutely. Like there's some good things, right?
There is.
But I think if it becomes just a comparison trap, if you are beginning to feel shame and judgment, that's where we need to, kind of draw the line.
Yeah.
And I really encourage moms to just take a step back, take a pause, even just, take a breather from social media if you're starting to feel just that weight that you are not good enough, because let me tell you, you are good enough.
Yeah. And none of that is real. I'm a photographer. Not none of that. I shouldn't go that far.
Yes.
But it's curated. It's a polished version, right, of what we want our lives to look like and what we want to present, and that's lovely.
Yes.
Just like with COVID, just like with any of these things, there are always silver linings that exist, but the truth of the matter is, nobody's house looks like that.
Yes.
No one's house that just had a baby or has little kids looks like that. So,
or even big kids.
Cut yourself some slack.
Like
yeah. And just, I agree. I think social media is this kind of, again, double-edged sword. It's wonderful. And I learn so much from other people that are sharing, and our reach is further. And so where we're working on this project, I hope that the reach of the extending hand, and here we all are, let's be honest with each other about what we're struggling with or what we're feeling like we succeeded at the end of the day. It doesn't need to all be negative necessarily, but it's okay to say the negative stuff too.
Yes.
And it's a gift to share yourself with other people that way. So,
love that gift.
Yeah, me too. It's all I want in the world. It's why I want to do this. And so I think it's really important. So as I'm kind of going into this and I'm going to meet with these women, what do you want me to have in my mind? Where do I need to be sensitive? What do you want me to know?
I think, honestly, just opening up the platform for the conversation is huge, right? We've talked about this, I feel like, at length, right? Normalizing the feelings that these families are having is just huge. Sure. Opening up the conversation, validating the feelings that everyone is having. Yeah. No shame, no judgment.
Right.
Just having an open platform without criticism, where families feel free, right? They feel safe.
It's like an exhale.
It is an exhale.
Yeah.
Absolutely. And just to provide families with the knowledge that there's help out there. I think that,
and maybe pushing for more,
right,
for more of that.
Right, and encouraging them to seek help. We'll certainly kind of share some resources, but there is help out there.
Yeah.
Just don't give up.
Yeah, I think that is it. Please don't give up. We need you here. I think, it's hard. It's emotional. And I struggle with that because there's just so many people that kind of lose sight of, you start to think, well, they'd be better off without me.
Yes.
I am the problem. Thanks, Taylor Swift. Sorry, it's in my head. But they think you really do genuinely start to go down this road of like, well, maybe they'd be better off if I wasn't here. Maybe, they'd be healthier if they weren't having to combat my big feelings and my big reactions or my whatever it is that you're struggling with. And I don't want to see people give up on themselves and their families because those kids need their mom.
They do. Absolutely. And if I remember correctly, maternal suicide is among the top 3 leading causes of death for moms within that first year postpartum. Yeah. And so, again, we've talked about this, like there's so much to do.
Yeah.
Call to action for parents, for moms, dads, caregivers, certainly reach out to their provider, reach out to their friends that they feel safe with. There's a lot to be said about just taking 5 minutes to get outside into the sunshine, right? Yeah. Take that time.
Take a shower.
Take a shower.
Take a shower.
All by yourself.
All by yourself.
All by yourself, right? Looking at, if you have like the wherewithal, right? Looking at your nutrition, if you're able to, right? Eating those like high protein snacks. But as I say this, right? I feel like during that postpartum time, all the things that you're supposed to do.
I'm so glad that you said that.
Right? But then actually having like the strength to do
the energy and the any of it. Yeah.
Right.
Yeah.
And so if you do have like a partner who can encourage you, for sure, have those conversations.
Right.
But it's hard. It's difficult.
Yeah, I agree. I hear that over and over and over again. I know what I need to do.
Yeah.
I know what I need to do. I just can't find the energy to care enough about myself to do what I need.
Yeah.
And I think that's if we can keep saying that out loud and helping each other, I think you're right. That's the bottom line.
Right. And, seeking support, seeking counseling, starting, psychotherapeutics is absolutely okay, right?
Yeah.
Just like we were talking about, if you're on an amoxicillin first rep, it's okay if you are taking Prozac for your symptoms of depression. Doesn't mean you're going to be taking Prozac forever.
Exactly.
Right?
It's not forever.
Right. And, as far as like stigma, right, we really need to, I'm so passionate about reducing or even eliminating any kind of negative stigma towards mental health.
Right.
And so, if everyone who takes Prozac wants to raise their hand, if that works, right, to help one mom feel okay to seek medication from her provider.
Absolutely.
Girl, proud club member.
I agree.
And so.
Yeah, thank you so much.
You're very well. Thank you.
Appreciate it.
I feel so humbled and proud to be a part of this project, and I applaud you for having the vision and the courage and the wherewithal. This is a very big undertaking.
Yeah.
And I think we talked last week about if we are able to have the positive impact just on one person.
Yeah.
If one person is able to have then the energy to seek that support.
Yes.
Mission accomplished.
For those women pouring on over the internet at 2 a.m. like I was,
right,
just wondering, is there anybody else out there struggling the same way I am, or any kind of way?
Yes, and they are.
Yeah.
They are. And
it's awesome.
Yes.
It's awesome that we want to make the effort. And I've said before too, however far this reach goes, it exists in the world, and that is important, and that matters. And even just you and the other women that will participate in this, it will impact them. And for me, that's enough. That's a beginning.
Right. And maybe, during that chapter for them, they won't have to feel so either low, feel that irritability, that isolation, that anger, that resentment.
Ooh, that's a big one.
Right? Mm-hmm. And so just the work that you are doing right here is going to make a difference.
I hope so.
Yeah.
I hope so. Thank you for your input.
Thank you.
And I look forward to talking to you again, because there's a lot to cover.